Welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton, and on this segment, we'll be hearing from Valronica Scales of College Park, Maryland. She was diagnosed with papillary thyroid cancer and survived. It was a journey with numerous steps, which we're going to hear about, and we hope you will find her story to be informative and inspiring. So now let's get to it, and Valronica, welcome to Cancer Interviews.
Thank you, Bruce, for having me. I'm very happy to be here today.
And we're happy to have you. Valronica, first thing we do with each interview is we want to get to know a little bit more about you, where you're from, what your life's work is, and the stuff you like to do when you have free time. So tell us a little bit about yourself.
Awesome. Well, I'm Valronica Scales. I am originally from what I consider the great state of North Carolina. I was born, believe it or not, in Boise, Idaho, but moved back to North Carolina a little less than 1 year old. I have a twin sister and an older brother, and was raised by a mother in a single family, and that's where I'm from. But what I do now is I have been bouncing around the country between North Carolina, St. Louis, Chicago, and I've landed in College Park, Maryland, and I've been bouncing around because of my career. So my career is working in higher education and student affairs, and I am the director of resident life. I'm at the University of Maryland, College Park, and I've been in residential life working since I was a sophomore in college, since I was 19 years old, and only took 1 year off to work at a charter school. So education is my life. I'm also a full-time doctoral student doing my degree in adult and higher education. And in my free time, which I don't have much of these days, between trying to bring our students back safely in a COVID-19 era, and trying to finish my degree virtually, I like to cook. I like to explore outside. I like to ride my bike. I have a road bike. And other things that I like to do, I really do enjoy Netflix and finding new movies. And so spending some time on my couch by myself with my little miniature schnauzer is a part of what I do now to relax and unwind.
Okay, so Chicago, St. Louis, College Park, which did you like the best?
Chicago. I don't want people to feel like I'm biased against College Park or St. Louis, but Chicago was the first city I had ever really lived in outside of North Carolina. I felt like I grew up there, and I felt like I really got to understand the world in my own terms in Chicago. And you can't beat driving by Lake Michigan every day. So the city life, the downtown life, is where I lived, and I loved it. And I have a lot of good friends there who were basically my second family away from home. Okay, and cooking, any kind of cuisine that you like? Yeah, I love Asian cuisine. I do. I love cooking bok choy and beef and noodles and different meals with fried rice and sesame, with fresh veggies and chicken and pork and shrimp. But I would say that's not my specialty. I love cooking that food. I like exploring that food. I love pho, or pho ga, which is chicken pho, which is a Vietnamese food. Yeah, that's probably my favorite food, honestly, is Asian cuisine, and pho being probably my most favorite. But not right now because it's too hot here in Maryland and DC. It's too hot for it.
Okay, let's examine the part of your life that existed before you were diagnosed for the first time with papillary thyroid cancer. In terms of health and that sort of thing, was everything fine prior to your being diagnosed? Yeah, for the most part. So I was really active. Like I said, I have a road bike. I was working out. And I was doing a lot of exercising. So I had a really little puppy that we would walk almost a mile every morning before I'd go to work. And I was pretty healthy. I try to watch what I eat. I do enjoy, just like everyone else, maybe a slice of pizza or a burger every now and then. But I was pretty healthy. And then I realized probably in 2015, I was gaining a lot of weight, and I had gained like 40 pounds in a year, and nothing had really changed. And so I was portioning my food sizes. Like I was eating really small food portions to try to figure out
am I eating something wrong? Am I eating too late? Am I eating the wrong foods? And I was just continually gaining weight. And so that's when I knew something was wrong, because I had 40 pounds in 1 year for me at 5'2", is a lot. I'm really short and petite. And then for me, that was an alarm of something's wrong and I need to figure out what it is.
So at that point, when did you see a healthcare professional?
So actually for 6 months, I had been seeing different doctors. So I had been to urgent care. I had been to my primary care doctor facility. I had been to probably urgent care. Let me say this. I was doing the wrong thing here. I had been to urgent care maybe 3 or 4 times, and they kept saying, you have some kind of infection, and here's this antibiotic to treat it. And then finally, in July of 2015, I was home in North Carolina for my mom's birthday, and I looked at my twin sister, and she is very well versed in the health field. Her partner has some medical issues, and so she's taken a lot of classes for being a certified nurse's assistant. And so I said, look, I have this thing on my neck, and I think it's my tonsils are swollen. And she said, Valronica, those are not tonsils. Those are your lymph nodes, and they look like they're going to pop. And I said, oh, okay. I didn't know that. I said, I thought it was just my tonsil. It was really poking out of my neck. And, she said, when you get back to St. Louis, go see your primary care doctor and talk with him. And so that's what I did. And that was in August 2015.
So did you go from there to a specialist?
Yes. So August 2015, meaning me, I went to see my primary care doctor. I said, Dr. Bonzelet, something is wrong. I said, I've gained 40 pounds in a year. I've got this node sticking out over here. And so he did his exam, and he said, you have 5 golf ball sized lymph nodes on both sides of your neck. And he said, I've got to get you in to see a specialist. And he said, you need to see an endocrinologist. And I said, okay, well, who should I see? And he says, well, my buddy, who I went to med school with, Ryan Jackson, is new here in the St. Louis area. He's working at WashU at Barnes Jewish Hospital. And I think he'd be the perfect person to see. Here's his phone number, schedule an appointment. So I called to schedule that appointment, and they were like, oh, we can't get you in until October. So I called my doctor back. I called Dr. Bonzelet, and I said, hey, they said that they're booked until October. And he said, let me call him. So he texted him and said, I have a patient who has 5 golf ball sized lymph nodes on each side of her neck, and I really need for you to see her. So they called me in and said, we have this one appointment slot, and it's at 10 a.m. on August 26th, which happened to be move-in day. Remember, I said I work in Res Life. And they said, this is the only appointment we have, and so do you want it? I said, of course. So I told my boss, I said, hey, I have to leave campus at 9:30 to get to this appointment. It's move-in day, so I've been at work since 6 a.m. And so I head on over. I get to the appointment. He puts the scope on his head, and his nurse, her name was Lisa, a shoemaker, they were like, oh, it looks like it's just some kind of infection. And I said, okay, if it's just an infection, then we're good to go. And that's what, urgent care had told me. It's what other folks had said is probably just some kind of infection. But his nurse, Lisa Shoemaker, said, why don't we do an FNA, a fine needle aspiration, just to be on the safe side for your own peace of mind? And I said, well, he just said I don't need that. And she said, for your own peace of mind, let's just do it. So on that day, on move-in day, they come in with this large needle, which is a fine needle aspiration, is a large needle gun. They numb up my neck, and they do 3 aspirations. And they do three, I don't know if it's called aspiration, but they do 3 of them and pull out tissue and everything else to test it. And so I went back to work because it's move-in day and I have to work 12 hours that day. And I have a little bandage on my neck from where they've done it. And, as soon as I get back to campus, everyone's asking, what's going on? And I said, oh, it's just a test that they're running. And I take it off and go about my day. For me, because it's just normal, I'm going to keep on moving, right? A week later, I'm at work, and my phone keeps ringing, and it was my personal phone. I work in Res Life, so we have a work phone, and I didn't have my personal phone on me. And I looked down and I was like, why does this 314 number keep calling my North Carolina number? And it's because it was the doctor calling. It wasn't the nurse. It wasn't anyone else. It was the doctor. And so he had left a message saying, this is Ryan Jackson from Barnes-Jewish Hospital. I'm just calling about your test results. If you can't, give me a call back. And I was like, why is the doctor? The doctors never call. It's always the nurses. And so then they called me back and said, hey, we've been trying to reach you for a day. It turns out you have papillary thyroid carcinoma, and we need to get you scheduled to come in so that we can get a surgery scheduled and also get some ultrasounds completed. And I was in the middle of work. I was unloading a van. These are things that you just don't forget, right? I was unloading a van for our sophomore welcome back barbecue with my co-advisor. And, we're unloading and he looks at me and he says, Val, are you okay? And I said, Ethan, will you ride with me around so we can go park this van? So we're driving and he was like, was that your doctor? And I was like, yeah, that was my doctor. And he said, well, what did they say? So I'm like driving. And I said, well, they just told me I have cancer. And he was like, you need to go home. And he was like, I'm so, he was so apologetic. He was like, I'm so sorry. It sucks, but you should go home and process. And I said, what am I going to do at home? I said, sitting fried on my bed with my dog. I was like, we have a barbecue tonight for our 2,000 sophomore students that I am in charge of. And I said, I still have to do this. And so we parked the van. I walked back into the office, and it's at noon at this point. And my good friend Tamara was leaving the office to go grocery shopping on her lunch break. And I said, hey, are you going to lunch? She said, no, I'm going to Aldi's. And I was like, okay, can I go with you? And Tamara is kind of like my second mom at WashU. She's in her 50s. She basically took me under her wing when I started there. I had Thanksgiving with her family every year that I lived there. And my mom and her are friends. And so we're in her car driving off of campus. And she says, hey, have you heard back from your doctors? And I was like, yes. And she said, well, what did they say? And at this point, we are literally in front of my office. And I said, well, and this is when it finally hit me and I started crying. And I said, they told me I have cancer and it's thyroid cancer and I'm going to have a surgery. And she pumps the brakes and we both start crying in her car. And I remember our good friend Gwen, who was a police officer out on campus, she came up because we were sitting in the middle of the road. And she said, are you okay? And we like wipe our tears away. And we said, yeah, we're fine. And we drove and had pancakes for lunch. We didn't make it to the grocery store. And she said, you need to call your mom. And so after that, after we eat pancakes and cry a little bit and try to figure out what this means for me as a 30-year-old, and I don't know, was I 30? I was 30 then. What it meant for me, we basically decided that I would call my mom from outside and let her know what was going on. And I'll never forget that day. Never.
Well, it was positive that you had a very important person with you, but was Tamara or other people of emotional assistance to you in the next couple of days?
Yeah, so, my boss, his name was Rob Wild at the time. I told him that day because, everyone knew that I'd had this test. And so he came in my office. It was late. It was the same day. My dog was with me on campus because we were doing barbecue, and he loves miniature schnauzers. So he was playing with my dog. And so Tamara was of great emotional assistance, my mom, Rob, and he said, I looked up thyroid cancer, Val, and he says, it's got a great survival rate. And he says, just know we're in your corner. Another colleague, her name was Laura Clark, and she was a breast cancer survivor, and she was very helpful in helping me navigate what I needed to do on my way out to have the surgery. And then another colleague, Rhonda Kiley, and she's a thyroid cancer survivor as well, in my office. And so all of those folks outside of my family, because I was there by myself, were super helpful, and Ethan as well. And those are folks who were immediately in my, people I could connect with physically. Outside of that, of course, my mom, my sister, my brother, my entire family, honestly, were of great emotional support. But it didn't hit me that this was going to be a journey before the surgery. I honestly thought, it's thyroid cancer. People survive thyroid cancer. I'll take a pill, every day, and I'll have the surgery, and I'll give my radioactive iodine, and everything will be okay. Little did I know what was going to follow the surgery and what they would find during my surgery. So.
Now, Veronica, before we go any farther, I'm telling you something you already know, but for somebody watching, they might not know this. There's more than one type of thyroid cancer. Papillary thyroid cancer. What does that mean? What is affected?
Yeah, so the papillary thyroid cancer is a single type of thyroid carcinoma, right? So there's anaplastic, and there's also a few others. And when they rank papillary thyroid cancer, they say that it is the most common thyroid cancer, and it's one that has the highest rates of survival. But with papillary thyroid cancer, you can also have different features that go along with it. So you can have a tall cell variant, which is an aggressive type of variant that can coincide with your papillary thyroid cancer, or you can also have what I have, which is a hobnail feature, which is a very unique type of feature when it comes to them looking at the cells, and another aggressive feature of papillary thyroid cancer. So most people who have papillary thyroid cancer have some complications when it comes to memory and fog and getting their levels right, because the thyroid controls so many things that you don't think about. It controls your body temperature. It controls a lot of your mental stamina. It controls sometimes how you sleep. And so your thyroid, I didn't even know the thyroid was really a thing, or what the function was, until I had to have it taken out of my body. And so those are the different kinds of papillary thyroid cancer. But there are, 3 or 4 kinds of thyroid cancer that you can have.
Now, Veronica, I have to ask you this because, again, everybody's cancer journey is different, and each type of cancer is different, and some types of cancer give the patient options in terms of treatment, and others don't. Did you have options as to what to do in terms of treatment?
I didn't have too many options, and that is... I should explain. I should explain why I didn't have too many options. So is it okay for me to share my surgery story? And
go right ahead.
Okay, because that helps explain why I didn't have too many options post that. So my surgery happened on October 11th. I think that was the day. It was in October 2015. I had just come back from a wedding in Hilton Head, South Carolina. My best friend had just gotten married. I was speaking in their wedding. And, they knew that I had cancer, and they knew I wouldn't be able to stay the full time. So I came back. My family had already flown into St. Louis. And, it was actually October 5th because their wedding was October 3rd. Small detail of things that took my mind. But my surgery, I had to be at the hospital at 6:30 in the morning. And they said, your surgery will last 3 to 4 hours. My surgery ended up lasting 8 hours. So I actually had a lot of cancer in my body, which is why my options were limited. So they took my entire thyroid out, and it was full of tumors. They took out 99 lymph nodes on both sides of my neck, and 33 of those lymph nodes were cancerous. And then I had cancer that was going into my chest, and cancer that was going into my back. And those were the lymph nodes that they removed. And when people look at thyroid scars, they're usually small in here, but because mine was so aggressive, they actually cut higher into the crease of my neck so that it would be less noticeable when I smile, and they call it my second scar. But as soon as I turn my neck, you can see that my scar goes a little higher up because there were so many lymph nodes that they had to remove. And so 8 hours followed. You were supposed to be in the hospital for, 3 to 4 days. I was in the hospital for a full week. I almost went into a calcium coma because they had to pull out my parathyroids and then re-implant them. And my parathyroids weren't working normally by that time. And so I was taking a lot of drugs in the hospital to try to get me back to normal and so that I wouldn't go into a calcium coma. My mom from North Carolina stayed with me the entire time. I really wasn't expecting to be there that long. And so my brother, who had flown in from North Carolina as well had to leave while I was still in the hospital because his trip here was only for a week. And I was in the hospital for almost 8 to 9 days. And so he had to leave while I was still in the hospital. And it just, it broke my heart because I was still there and he had to leave to get back home to his family. And in the hospital was when they told me I had a tall cell variant and that my thyroid cancer was aggressive. They also asked my mom if I had been exposed to radiation as a child because the amount of cancer in my body, specifically in my neck and chest area, was a Chernobyl-like cancer. And that's what the doctor said. And I said, I was not exposed to any radiation. I have a twin sister. I have a brother. Everyone else in my family is super healthy. And somehow I ended up getting this cancer that was like plaguing my body. And so that is what led to my treatment options. And so when they found out that I had the tall cell variant, they sent me to a radiologist. And he decided you're going to have your radioactive iodine, which is very common for thyroid cancer patients to take. It helps you for you to see whether or not you still have cancer in your body when it uptakes. So they give you the radioactive iodine medication. They give you a little warning or a card that says I'm radioactive. And then you come back for your scan. It turns out I am radioactive iodine resistant or avid, and it didn't uptake. And so we do the scans and they're like, oh, it looks like your cancer is gone. And they're like, that's not right. They said, this isn't right. So then they scheduled a PET scan. And the PET scan is a glucose strip. And the glucose strip showed that, my cancer was still there. So the radiologist said, we really only have one option here, and it is radiation treatment. And so radiation being treatment. And I was angry for the first time since I had been home, because I was under the impression I would have the surgery, that I would recover, that I would have the radioactive iodine, and then I'd go back to work, and then I'd have a normal life afterwards, right? So here we are at the end of October. I've gone through all of my scans, and October 31st is the radiologist is telling me you need radiation external beam therapy. And I think that's really when my cancer journey began for me, because before then it was just like normal. And no one would say that that's normal to feel that way, but what I experienced going into a hospital every day, into the cancer ward, 30 to 31 treatments. And it was excruciating. And I'm really trying not to get emotional, but it was a very excruciating pain.
How many radiation treatments did you have, Valronica?
I had 30 to 31.
Ooh.
Yeah. So I went every day until November, until December, mid-November till it was either right after Thanksgiving or right before Thanksgiving until December 31st, 2015. So my last day of treatment was December 31st, 2015. So New Year's Eve, I celebrated by ringing the bell. And, but the journey to get to that bell, I thought that, I was going to die. I can't really, there's no nicer way to put that. Right. So because my radiation was through my neck, I ended up losing those 40 pounds plus more, because I couldn't eat. I had a very special diet. I had a dietitian that I worked with, and that I met with every Tuesday. And she, I think week 3 or 4, said to me and my mom, if I didn't start eating fat, and if I didn't drink the protein shakes, like Ensure, that I would need to go on a feeding tube because I wasn't getting enough nutrients. And so that's when my mom started fixing lots of soups with extra butter and fat in it. It's when she started making like oatmeal and soft foods that I could swallow, scrambled eggs, and different drinks that we would add thickener to so that I could actually drink it. Because halfway through my treatment, it would hurt to swallow even water because it was so thin and it would hurt. So the radiation basically made my entire throat raw. And because the radiation was from my chin to the middle of my chest to my shoulders, I lost a lot. I call this my new skin. And so I lost all of my skin through here. And I also couldn't talk for almost 3 to 4 weeks, and I could only whisper. And that was the highest that I could talk. And so I lost my voice, my singing voice. I lost the ability to eat bread or carbs in any form. Not now. I still love my carbs now, but in that time. And all I could eat were salads and soft foods and drinks with thickener. No hot liquids, none of those things, because they would burn my throat. And so when I made it to December 31st, it was a glorious day, to say the least. And one where I was extremely weak, but extremely proud that I had made it through that part of my journey. And that my family was there with me. My mom had essentially moved from North Carolina to St. Louis and lived with me from October through February to help me through this journey.
Our guest is Valronica Scales of College Park, Maryland, who has survived papillary thyroid cancer. And you're watching the Cancer Interviews podcast. We also invite you to check out our homepage on our website at cancerinterviews.com. Now, Valronica, we've heard about a lot of what you couldn't eat. It sounds like during that time you weren't very active. Were you confined to the bed or sofa, that sort of thing?
No, I was actually working. So I had gone back to work. I try to keep things moving. So I actually went back to work part-time, and, I had a schedule. So I would go to my radiation treatments in the morning, and because I couldn't drive after that, my mom would drop me off at work, and then I would work 4 to 5 hours a day, and then she'd pick me up and I'd go home. And I did that for the entire first part of my radiation treatment until, I don't know, week 4. And that's when I went back home, because radiation is no joke. If anyone has had radiation, you know how hard it is on the body. And so week 4, I went back on medical leave and just did my treatment and tried to keep my energy up. But for the most part, I was back at work. My friends, I was hanging out with my friends. They would come pick me up. We would go back out. And but the last part of radiation was, I think, the worst part, because it's when my body had started to break down a little bit. So I was home, I was confined to my bed. I was able to walk my dog short distances, but I wasn't even able to drive. My mom actually drove me to and from my appointments during that period.
So when did you feel like you had the upper hand, like you'd turned the corner a little bit, because you were able to go to work, you could hang out with your friends, but it sounds like there's only so much you could do. When did you feel like you turned the corner, when you could do more activities?
Yeah, so I think December 31st was my last treatment, and it took a while to recover. So I would say by early February, I was starting to feel a little bit more like myself. I had, at that point, I had sought out a therapist in the cancer treatment center at Barnes Jewish. And I was seeing her regularly and weekly to try to help me cope with my new life. And there's no way to hide a burnt neck and a chest. And you know, it's not easy, especially in the winter time when you have to wear open tops. So I wore a lot of big scarves and scarves that wouldn't cling to my skin. And so I would say early February, I felt much better. And so I was able to eat. And I remember my birthday is February 8th. And my mom took me out to have some seafood because I can still eat. I could eat protein then, and I could eat salads. And so she took me out for my birthday, and we had a happy hour at one of my favorite seafood places in St. Louis. And so that's kind of when the turn happened. So it took about a month for me to recover. And then February, I started feeling a little bit better and having a bit more energy. And I traveled to Florida for work. And, you know, that's also when I learned that I had lymphedema. And lymphedema, for folks who don't know, is when you have lymph nodes removed and the fluid has nowhere else to go. So it sits within your the area where the fluid usually would be pulled away by your lymph nodes. And so I learned in February as well that I had lymphedema because I flew to Florida. My neck was so hot. And it ballooned up, and I said, wow, this is hot and it's burning. I called my doctor and they said, well, we took out 99 lymph nodes. You're going to have to get a facelift thing when you fly. And just like breast cancer survivors get it often in their arms and they have sleeves that you may see them wearing, it's because of lymphedema. And it's a compression sleeve that helps keep the pressure. It compresses it so the fluid still moves. And so during that time, I got the compression sleeve for my face. I wore it when I flew, and I would put a scarf on because it covered the top of my head and your chin, and it like compresses your neck. So it's a funny contraption, but it works. And so I learned that in February as well. And I think then is when I knew this is a lifelong journey. This is not something that I'm going to be able to not think about. Because, you know, I take my medication daily. So my levothyroxine daily, my calcitriol, because my calcium is low and I don't absorb calcium. I take, calcium and calcitriol, and mainly because my parathyroids were burned off during my radiation treatment and they never recovered, even though they had been retransplanted. And so February is when I started feeling like I am going to have to learn how to manage this and not let it manage me.
Would you say that, and I'll need some help with pronouncing lymphedema, is what?
Lymphedema.
Lymphedema. Would you say that in terms of the aftercare phase of your journey, that is easily the toughest part?
No, not the toughest part. I actually had to go through physical therapy in addition to having lymphedema because they cut so high on my neck. Some of the muscles in my shoulders were basically needed to be reworked. And so I went to physical therapy for 6 months after my surgery and after my radiation. And I had massage care. So they would massage my area here because the radiation created striated muscles, which are really tight and really tense. And so if you don't work those muscles out, they just stay tight and tough. And so I went to physical therapy until, July of 2016, trying, and twice a week, not once a week, but twice a week. And saw the same person every time that I went to work out the muscles and to get my range of motion back. So I could only turn my neck partially, like this far, because of the radiation. And so I had to get a lot of help. And so the lymphedema was not the hardest part. It was the physicality of relearning how to move my body and my upper body again.
Mentally, how challenging was that? I mean, obviously, physically, it's not easy. But what's the mental part of knowing that you're battling this almost every day?
Well, mentally, it was a challenge, and that's why I started seeing a therapist. I was crying a lot, and my mom said, "I don't know how to help you." She herself has never had cancer, and we don't have that many cancer stories in our family. And so she was the one who actually found the therapist that I've actually been seeing for the past 5 years. And so she found her, and I started seeing her, and they said, you've had a lot that's happened in a short period of time. And I had to learn how to cope with it. And I think coping with that and finding the positivity in things and finding what brings me joy was the most important, because it's easy to focus on the things that are so negative and going wrong in your life. But for me, it was like, what is right? I'm still here. And, I didn't have to go on a feeding tube. I didn't have to, I had insurance and a job that allowed me the time off to recover from this. Right. And so I chose to focus on the positive things that could help me be successful in the journey instead of the negative things. Were there things that I lost? Sure. I lost a relationship during that period, between the cancer and my recovery, and it just didn't work out. They just didn't understand what I needed as someone who was going through that journey. And so, yeah, there were a lot of losses during that period, but the positive part for me was actually relearning who I was, really figuring out what is my purpose here, and figuring out how can I take this journey and change it? Because for me, it wasn't about a woe is me atmosphere. And then honestly, I have to say, if it wasn't for THICA, so the Thyroid Cancer Association, I would have been feeling like I was by myself. And so I found that I didn't find it. Again, my mom found THICA, and we started going to THICA during my radiation external beam treatments. And I couldn't talk when we were going, so my mom had to talk for me, and she drove me to the first meeting. And I've been an active member since then, since 2016, since St. Louis, Chicago, and now here in the DMV area. I've been an active member because of that. So yeah, it's hard, but it wasn't too hard.
Valronica, before we go any farther, THYCA is capital THY, capital CA. And,
Yes.
And if you would just tell us a little bit about that organization, what it's about and what it does.
Sure. So THYCA is the Thyroid Cancer Association. They were founded, almost 20 years ago by Gary Bloom and a guy named Cal. And they support thyroid cancer survivors, all thyroid cancer survivors, not just papillary, but metastatic and others as well. There is an international conference that they host annually. I volunteered with them in Chicago a few years ago as a patient for endocrinologists to see what a thyroid cancer patient looks like. But also, I'm just talking about our association. And I say our association because I'm a member of it. And right before I got on this interview, I was actually on our call. So we meet monthly in different areas of the country. And because we are in a COVID-19 era, it's a Zoom call. And today there were about 15 people on the call just from the DC metro area. So it's DC, Virginia, and Maryland. And so the group is really important. They talk about diets before you go into your treatments. There are endocrinologists that are part of THYCA and surgeons. And so anytime you have a question and you're moving, there is a group of folks who are in the area who know the best doctors and the best resources for you in that area. It's actually how I found my endocrinologist here in Baltimore. And it is honestly some of the best people I've ever met, who understand you and will support you.
Now, Valronica, I have to say that some years have gone by since your procedure, but I'll tell you, these days, you look like the picture of health. In any way, are you less than 100%?
Absolutely. So I've had a few recurrences already. So I told you 2015, I ended with my radiation external beam. 2016 in April, I had a recurrence. And because the recurrence was within the field of the radiation, Barnes-Jewish said, we can't help you, but we know who can. And so my endocrinologist, not endocrinologist, but my surgeon, Dr. Ryan Jackson, said, I did my fellowship at Mayo Clinic in Rochester, Minnesota. They are the best people and they can help you. And he called in a favor and I was able to see the doctors that trained him. And so we drove up to Rochester, Minnesota with my family, and they took one look and they said, oh, Dr. Jackson, you did a beautiful job on my surgery. But then they said, I still had cancer, but the cancer was under my collarbone. And it was in an area that he would not have seen. And so they ended up doing what they call ethanol alcohol ablation. And they call it a therapy, but it's not really therapeutic. It hurts. And so I went back later that summer for the treatment. And what they do is they end up just taking 99% ethanol alcohol and injecting it directly into the cancer cells. And what it does is it shrinks the cancer cells. And they did tell me that I was not a candidate for another surgery, basically because of the external beam radiation and the amount of striated muscles that I have in my neck. And so they said, if we were to do another surgery, your healing time would take double what it took the first time. And they said, we just don't feel comfortable doing that. And so that's why we went down that route. That was 2016. So it was very quickly afterwards. I have had numerous amounts of bouts with my health since then. So I've had my appendix taken out because I had a cancerous tumor there. I've had some other issues when it comes to my lungs. And so what they consider METs or metastases is that you may hear me breathing a little bit heavy. It's because I have 30 to 40, what they consider lung metastases or lung METs just hanging out in my lungs right now. And, there's nothing that we can do about that. And there's nothing that I can do about it. And so I was working with a pulmonologist before I left Chicago, and I have 2 therapeutic inhalers in case I lose my breath or if it's too hot. And I rarely use those. And so I really try to practice staying healthy, exercising, yoga, meditation, so that I can keep my my stress level down. Who knows how I got this cancer? Who knows if my yoga and meditation and therapy will help me to keep my stress levels down enough? No one knows. But what I do know is that I see my doctors every 6 months. I go in for my blood work and they test my tumor markers, which mine are thyroid globulin. And I just got my test results back and they're looking great. And so even though I have these lung mets, as long as I stay suppressed and I take my medication daily and we keep the right levels, I have a really good prognosis. And that's what I look forward to every day, is that I know what I need to do to stay healthy. And so those are the things that I have to think about. What can I control? And my locus of control is my diet, it's my health, it's my stress level. And those are the things that I can control. I unfortunately can't control these lung mets. I can't control if I get another tumor, but I can control those things. And so that's what I choose to focus on. But I also make sure that my doctors know that I'm a very active patient, and I really like to know what's going on in my health. And I ask very direct questions so that I can better understand what the prognosis is.
Well, Veronica, you've certainly been through a lot. I think I know the answer to this question, and it's kind of a mouthful, but I still want to hear it from you. Would you say that physically, mentally, emotionally, you're optimistic about the future?
I am very optimistic about the future. My cancer diagnosis, it just does not define who I am, but it is a part of who I am, and it's a big part of who I am. So whenever I meet people for the first time, especially when I'm dating, and I say, I'm a cancer survivor, and what does that really mean for me? And I share that with folks because it is such a big part of me. It's physically a part of who I am. And I just think the future is so bright. And, as long as I can control what I can control, and I am in touch with my doctors and they can better help me understand what medications I need to control this, I feel good about it. And so for me, yeah, I think I'm optimistic and positive, and I look forward to a long future.
Veronica, we start off our interviews from the same place with everybody, and we try to end from the same place. Mm-hmm. Try to imagine now that there's somebody watching or listening who has just been diagnosed with papillary thyroid cancer. If there's anything that you would like to share with them, any overarching thought, what would it be?
My thought would be, make sure that you are talking with your doctors and your care providers about what is it that you need. Ask doctors about your levels, and make sure that you are active in your treatment and your care. And I say that because a lot of times hospitals and doctors, they have one way of treating patients, and we are all individual patients. And that's really important for everyone to hear, because if you take an active interest in your own journey and your own health and your own treatments, it will be better for you in the long run. And the other thing I'd say is, if you're diagnosed, join THICA. The Thyroid Cancer Association is full of people who have been living this journey for over 40 years. And so two of my mentors, Teresa Wickersham and Gary Bloom, are both almost 20 to 40 year survivors of thyroid cancer. And they lead the organization and are full of wealth and knowledge for all people who are going through this. And so join our organization, come to one of our conferences when we can have conferences again, and reach out to other folks who have been going through this. You don't have to go through it alone. And because the thyroid manages so many things in your body, including your emotions, make sure that you're seeking out professional help, or that you're talking with someone, because something that you may be feeling, you're not going to be alone. But the mental fog and weight gain and things along those lines, it's normal for folks who have thyroid issues. And so just know that you're not alone, and seek out that help.
Well, that is the message that we try to send out to everyone who watches and listens to our interviews. Before I go any farther, because we're about to wrap up here, Valronica, mm-hmm. is there a website, web address that somebody can go to learn more about the THICA family?
Sure. I think it's just THICA.org. But if you type in THICA, THYCA.org, you'll get to the Thyroid Cancer Association. It's a great association that I have been a part of for 5 years. And again, I don't think I'd be where I am today without this organization.
Okay, wonderful. Veronica, thank you so much for being with us on this segment. Thank you so much for sharing the story. It was a compelling story, and I think if anybody's paying attention, it's an uplifting story when they see the level of optimism that you convey. So, Valronica, thank you so much.
I really appreciate it, Bruce, and I am just so grateful that you asked me to interview with you all. So thank you.
Thanks, Veronica. And remember, on Cancer Interviews, it's a group effort. Everybody that we hear from, in a sense, they are here for you by telling their story. And here at Cancer Interviews, we're here for you also. And we just want to remind you that TEAM, together, everyone achieves more. So until next time, take care, and we'll see you on down the road.
Thank you, Bruce.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.